Picture this scenario. Have you ever been in a situation where during a consultation you have asked a patient a question only for them to really tense up, their body language completely change, their expression really, again, become quite negative, and they just build barriers and walls around them, and they completely shut down? Your intention as a healthcare professional was to demonstrate curiosity, to show interest, and to build trust. But instead, it has backfired and you have made your patient uncomfortable, almost like you have overstepped a boundary. So where is the line? How can you, as a healthcare professional, be curious, have that intention to build a good connection with your patient without making them feel like they're being interrogated or their boundaries or their personal space is being violated upon? So in this video, we're going to cover how you can demonstrate curiosity without being intrusive as a healthcare professional towards your patients. Welcome back to my channel, everybody. Thank you very much, as always, for your weekly engagement, support, and presence. My name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps healthcare professionals from English as a second language backgrounds become more collaborative, empathetic, and influential communicators in order for them to connect better with their patients and build influence, trust, and authority with them, and ultimately receive raving reviews and recommendations. So if you are someone whose English is not their first language and you're looking at ways as a healthcare professional, that's your job, and you're looking at ways in which you can learn more about how you can get to know your patients better, do things that are out of the box to communicate and connect better with them, and just need some guidance and support on tools and strategies on how you can go about that, you come to the absolute right place. So since our video last week, we have been looking at the concept of curiosity and why it matters, why it really is a game changer in the way in which that you can really build that trust and show that genuine interest, empathy, and get engagement and get more from your patients. And actually, at our video next week, I'm going to be interviewing my colleague Julie Pham, who has done extensive work on the concept of curiosity and its importance in communication. So make sure that you stay tuned for that. That video will be uploaded next week. But just going back on what we covered last week. So here's the thing when it gets tricky. Curiosity is great. We have already established that. But when does it become too much? When does it get to a point when you may be having every good intention and you may be coming from a good place where you want to really get to know your patient, especially if you want to explore the history of a patient. So if, say, you are, you could be someone like, even like an endocrinologist who wants to know why this particular patient of yours is showing symptoms of diabetes. So you might ask a question about, their family history. So anyone in their family, whether they have developed diabetes or not. And while that question is vital, I think sometimes what can happen is when they give you a little bit of a response, you can sort of tend to press on it a little bit more just to get more of the relevant information out of them. But that might be quite triggering to the patient. So that, they may have like a family member who has had a very bad experience with diabetes, which may have led to an untimely death for the patient. And this is particularly relevant when you are in the mental health space or in any kind of trauma therapy sort of space in which, to really get to know a person's patterns and history and, what it is that has led to the place that we are. Asking those questions is important, but you also have to be very careful about not overstepping and asking questions that are going to be making the patient feel triggered, attacked, or uncomfortable. I remember back in the day when my very first GP, when we first moved to Australia, when we used to go to see him for consultations. Now, my mum, being a doctor, really used to respect him a lot, and he was very good with his patients. But with me in particular, I think even though he was doing it from a place of really wanting to help me, this was at a time when I was very lost, very depressed, and just trying to figure out who I was and finding a place for myself in this world. I was also very isolated and lonely because back in the day, we didn't have social media like we do now, where you can find like-minded people. So in order to, again, really guide me, and in some instances I did used to go to him, he would always bring up the fact that because he saw that I was, quite an academic child, he would always ask, why have you not considered a career in medicine? Because his wife is a doctor, both his daughters are doctors, so he just could not get his head around the fact that, why someone like me who had the intellect that I did is not pursuing medicine. And he would bring it up every single time I would see him, even if it was not relevant to our consultation to begin with. And whilst I appreciated the fact that he considered us like part of his family and vice versa, this is where I became very uncomfortable, because I did not want our time to be told by somebody that my choice of career is not what they think I should be doing with their life. So I had to really put my foot down and say to him that this is making me uncomfortable. It's okay for you to get to know me and ask questions about me, but if I've made a choice and I've been very clear about that, I don't appreciate you asking me or trying to convince me that I'm not doing the right thing. This is just an example of when he was curious, and it was it kind of backfired in many ways. So there is a right way to be curious and demonstrate curiosity without overstepping those boundaries. Now, one thing you have to be aware of is the fact that different people are going to have different triggers. Different people are going to have different things that may be able to set them off. And expecting someone to really know that from top to bottom is very, very unrealistic. It's just not going to happen. But in that case, just on a fundamental basic level, these are some of the things where you can actually demonstrate and show curiosity towards your patients purely from a medical and professional setting, and without actually becoming intrusive and invading upon information that may be relevant to the reason that they have seeking your assistance and services, but also just keeping it very, very on a factual basis. So these are just some of the things that I feel that you can really incorporate. So the first one being that open-ended, but non-invasive questions. So instead of asking things like something like, are things okay at home? So just bear in mind that for a lot of patients, home environments can be very unsafe and very triggering places where they may not really feel like they are just being protected on a basic level, and there may be a lot of things that may go on that maybe have got them to the place where they are at the moment. So this is quite a common thing that people tend to ask, how things are at home or at work. So instead of doing that, you can ask something more generic, something like, how have things been for you lately? Have you observed any changes in your diet, in your lifestyle, in your exercise, in your sleep, or your stress level? So this is a much more generic question, but depending on the response that the patient is giving you, you may be able to then interpret and assume, correctly or otherwise, what may be happening at home that may be contributing to that. But instead of asking that question directly, it might seem like a little bit of an attack to the patient. So I would avoid that as much as possible. Now, secondly, gauge your patient's comfort levels. Now, sometimes patients can feel anxious, they can feel stressed, they can feel like a lot of negative emotions, and they can feel quite triggered and attacked in many ways. So a very natural response in that situation is for patients to give short, vague answers. And if that is the case, don't push your patient to give you more information, and so in that case, don't keep asking questions that are not that may be relevant to their challenge, but again, avoid going deep as much as possible, at least in the first few consultations, till that level of trust is built. When they do, however, you can absolutely explore that. So you have to sort of give this time and really gauge this as a case-by-case basis. Go with your intuition, go with your expertise, and just be aware of the body language and the response that the patient is giving you. Number 3, tie your curiosity to their health. Now, you might be asking a question that a patient may never have thought about. And as somebody who does interview a lot of people and who also coaches clients, I'm notorious for doing this. I will ask them questions that are very, very out of the box, and it gives them time to think about a good response and come up with something. And instead of asking why the question is without outrightly giving a reason, give them a clarification as to why you are asking this. So say, for example, if one of your patients is struggling to get a good night's sleep, if they're experiencing a lot of stress, or if, very simple thing, if you think that they are smoking or drinking too much, you can ask, how have things been at work and at home? Because the reason why I ask is not to pry in your own what happens at work and home. It's not really my business, but at the same time, to ask how the correlation that's there between your lifestyle and your habits and how that may be contributing to or be the root cause of your stress. So that's just another example. Number 4 is mirror their openness. So what I mean by this is when you get to the point when a patient is opening up to you and giving you a good response, definitely also open up about yourself. Now, I have made videos about this in the past, and I have made content on this on LinkedIn on how much information about your own personal life you can divulge during consultations. But at the same time, if they are opening up about something that they have in the past been quite uncomfortable sharing with you, just be mindful that you can say something like how you can acknowledge it by saying how that sounds quite stressful, that can be quite anxiety provoking, that can be quite not a pleasant experience. I can understand why it might be impacting you. And something that I always bring up in my videos and my content is no as a complete sentence. If they don't want to talk, and this can be very common in some situations for numerous reasons, just don't push it. If they have said that they are not comfortable sharing or discussing something, please don't take that further. I mean, that's what I had to tell the GP about. I set a boundary and I said, I do not wish to discuss my career choices in the future with you ever again. So like I say to healthcare professionals that you have to have your boundaries, you need to just as much respect your patient's boundaries just as much. So just to summarize, curiosity is one of the most powerful tools you can have as a healthcare professional. It helps you understand your patients better, build trust, and offer the care that actually fits their life and personalize their treatment. However, curiosity without boundaries can feel quite invasive. So you have to be intentional with the information that you're trying to get out of your patients, ask the right questions, get an understanding of their comfort level, and always make it about their well-being, not just to feed your curiosity. So the next time you feel like asking a question that can be quite intrusive and personal, just ask yourself, will this help my patients feel safe and understood, or is it going to just make them get their guard up? So that 1 second of thought can make all the difference. To stay tuned with more content on my videos on this concept and all facets of communication between healthcare professionals and patients, make sure that you hit the subscribe button and the notification bell. Give this video a like if you do indeed like it, and thank you very much for your time, attention, and presence, and I shall see you next week.